Good afternoon, students. So now we will discuss about gastric gavage procedure. So gastric gavage is nothing but it is the administration of nutrition or nourishment, giving nourishment by using a tube, any kind of tube. It can be Riles tube or Levine tube or any kind of tube either through oral or nasal or through an surgical opening which is made in the abdomen. So for now we will see the tube feeding insertion, which we are going to do through the nasal. So for nasal we will use Riles tube mainly. So before starting the procedure, if the patient is conscious, then we have to explain the procedure to the patient. And in this procedure, especially in this procedure, if the patient is conscious, then we need cooperation from the patient. So we have to explain very carefully to the patient, and each step we have to explain. And whenever we need cooperation for patient, we have to inform the patient. So if the patient is unconscious, then we have to keep the patient in supine position and we have to insert the tube. And if the patient is conscious, then we have to keep the patient in upright position. So now I am taking an unconscious patient, so I'll put the patient in supine position. So first of all, I have to wash my hand before starting the procedure. So I already washed my hand and I wore gloves also. Now, this is the Riles tube. And first of all, we have to measure. So how we have to measure means, from the bridge of the nose till the airlock, and then we have to bring the tube till the xiphoid process. That means at the end of the mid-clavicular line. So xiphoid process is here. So we have to measure till here and we have to mark here. So here I already marked. And after this, with the use of a right hand, I have to coil the tube like this, and then I have to put the lubricant jelly. And I have to apply it 2 to 3 centimeters of the tube so that it can insert easily. So we already applied lubricant jelly. Now we will insert on the left side of the nostril of the patient. So slowly we have to insert, and when we reach the larynx at that time, we will feel a little bit restriction. So at that time we should not pull forcefully. We should a little bit remove the tube like 1 centimeter, and then again we have to insert it in a rotatory motion, and forward and backward movement we have to insert very slowly. And in between, if the patient feels breathing difficulty or cough, at that time we should not insert further. We have to immediately remove the tube, because the tube may insert it in the airway. So like this we have to insert slowly. And if the patient is conscious, then we can ask the patient to swallow the water, and when patient swallowing water, at that time we have to insert 1 or 2 centimeter, and then we have to insert slowly until that mark which we marked when we insert. So I already inserted. Now we have to check whether the tube is in stomach in correct position or not. We have to check. How we will check means there are 2 methods. First, we will use a syringe, withdraw from the tube. At that time, if the stomach content is coming out like greenish or yellowish color, sometimes brown, so if it comes like that, then it is in correct position, it is in the tube is in the stomach. So we can also check like this, or one more method is also there. Here also we can use syringe. We have to blow the air and we should listen the sound with the help of stethoscope. So we have to keep like this, and we have to push the air like this. When you push the air, at that time you will feel the sound through stethoscope. So if you feel the sound, then the tube is in correct position. So now the tube is in correct position. If you want to give feeding, you should not give immediately after inserting the tube. You should wait for at least 1 hour. So we will cover the tube like this, and then with the help of adhesive tape we will fix the tube so that it doesn't dislocate. So like this we have to keep, and we will ask the patient to, if the patient is conscious, we will ask the patient to talk something or cough. If there is no problem, then we can keep the nasogastric tube like this. So this is about the gastric gavage. Thank you.